There is the possibility that some women who plan to give birth vaginally may need to give birth by cesarean instead. It is recommended that all expectant mothers and their birthing partners watch the following video about cesarean birth. Before your surgery for cesarean birth, you will need to sign a surgery consent form, and then your healthcare team will prepare you for surgery. Your baby's heart rate will be monitored. Your vital signs will be checked. An IV will be started if you don't already have one. Blood will be drawn for routine lab work. Your pubic hair will be clipped. A small tube called a catheter will be placed in your bladder to drain urine. You may be given an antacid to drink. Once you are prepared for surgery, you will be moved to an operating room. You may be given either epidural or spinal anesthesia, depending on what you and your anesthesiologist agreed upon. You will then be placed on a narrow bed where more monitoring equipment will be attached to you. As your healthcare team prepares you for surgery, you may feel anxious or nervous, which is very normal. This is a good time to practice some of the things you learned about in Chapter 1, especially breathing exercises and guided imagery, which will help you relax. Be aware of your breathing, taking long, slow, peaceful breaths in, and then slowly breathing out all of the tension you are feeling. Continue this for a while, a cleansing breath in, a relaxing breath out. Guided imagery may also help calm you before surgery. Allina Health hospitals provide MP3 audio players for guided imagery, or you may bring your own audio player from home. You can also guide yourself to your favorite place by simply closing your eyes and concentrating on the sounds, colors, scents, and textures of the place you are imagining. Stay in your favorite place for a few minutes, enjoying peace and comfort. Your birthing partner is welcome at the birth, but he or she must wear scrub clothes and not touch any of the surgical drapes, gowns, or instruments in order to protect you and your baby from infection.
All right, are you feeling here?
The anesthesia staff will make sure that you are numb or asleep before starting surgery.
Right here. Okay.
The surgery for your cesarean birth will take about 30 to 40 minutes, and your baby will be born 5 to 10 minutes after the surgery begins. When the baby is lifted out and the umbilical cord is cut, if you are awake, you may feel pressure at the top of the uterus, but you will not feel any pain. As long as neither you nor your baby need extra medical care, you and your birthing partner will probably be able to touch and hold your baby. The rest of the time in surgery is needed to remove the placenta and repair the incision in your abdomen. After your incision is closed, you will then be taken to a recovery area.